Thank you to SAGES for allowing us to present this information today. I'm Jaisa Olasky, a surgeon at Mount Auburn Hospital in Cambridge, Mass. I have nothing to disclose. Surveys of surgeons have identified knowledge gaps on basic surgical energy concepts. I'm not going to go through all of the data on this today. Some of it was presented at the fundamentals talk yesterday. A lot of it has been published in surgical endoscopy. But the Fundamental Use of Surgical Energy Program, or FUSE, was developed by SAGES to promote the safe use of surgical energy. The benefit of this long course, the full FUSE curriculum, and the certification process to address these safety topics is very well established. However, many surgeons, nurses, and hospital administrators have been asking for a smaller version of it, something that they can include in their regular annual online offerings. The goal of this project was to develop and evaluate a short, inexpensive online module that would emphasize key FUSE learning objectives. In addition, the idea was to make this accessible to all OR personnel. For methods, the SAGES FUSE committee developed a hospital compliance module. We developed this based on expert panel opinion. Essentially, it was FUSE experts that have been involved in the creation of the original curriculum and have been teaching it for many years. We did this with the guidance of the feedback about what information is most important to everyone in the operating room. We then also designed a survey to assess user experience. This was piloted at Beth Israel Deaconess Medical Center for a 90-day trial period. The hospital compliance modules were developed in a way where they can be loaded into most hospital learning management systems. So what you see here in this picture is the Beth Israel MyPath hospital learning system, and you can see how it's loaded right in with all of their other compliance modules. Once the 90-day trial period was completed, the data was able to be exported back to SAGES and was analyzed with a chi-square analysis. Here you see the blueprint that we came up with before we built the modules. You'll note that there's 3 modules listed. The first one is basically basic energy concepts, and then 4 multiple choice questions to reinforce what's in that module. Second one is fires in the operating room, and the third is implanted cardiac devices. There's an example here. I have the volume off, but we designed it with a narrator so that it's very engaging. Overall, the whole compliance module takes about 20 to 30 minutes. You can see here that it's interactive. As you highlight different things, it highlights the text. This is an example from module 2, lots of graphics to keep the user engaged. And then module 3. During the pilot, we only had the 3 modules. Subsequently, more recently, we did develop a 4th module on surgical smoke and aerosolization, but this was not in the trial. But I just wanted to show, for anyone interested in the compliance module, that there is a 4th module now. This was our survey that we designed, so we had several key questions to analyze the user experience as to whether or not they thought this was valuable information and how likely they were to change their practice based on it or recommend it to a colleague. Overall, we had 380 individuals complete the modules, so we were very happy with that participation. Here I've listed the percentage that were surgeons versus nurses, and also the total invited numbers. It did help that we had a mandate from the chair of the Department of General Surgery, or the Department of Surgery as a whole, to complete it. The reason that wasn't 100% was mostly because the invitations went out both via email and at grand rounds, and some of the email addresses probably overlapped or were emeritus status and such. In addition, the OR nursing leadership was very good about encouraging the nursing staff to do the modules. The vast majority of survey respondents did feel that the hospital compliance module taught them at least somewhat valuable information, 92%. And over 80% said it would result in a change in the setup or use of energy devices in the operating room. We did some subset comparisons. The 2 largest groups of user participants were the surgeons and nurses. And there was really no significant difference in their responses. You can see there's one small difference there, but for the most part, all different users felt that it was very valuable. We also did have one question that was open-ended, and when we got the results back, over 50% of those were positive results, so I've listed the positive ones here. Of the result, the rest of the results, probably about 30% weren't positive or negative. They were really just feedback on how we could change the look of it, or how we could make the modules slightly different. And only about 1% were actually negative. There were some limitations, as you could see on the earlier slide, in terms of participation. The House staff participation was a lot lower than we would have liked. We also sent it to all of anesthesia and got 0 responses from them, so we would have liked their feedback as well. But overall, we do feel that this is a prepackaged short course on the safe use of surgical energy. Our 90-day pilot testing was very successful, and over 90% of the users felt that it was beneficial. And overall, it was an effective and efficient option for hospital systems to enhance staff education and patient safety, and we think it should be considered for more widespread distribution. I've listed here the website where you can find more information. It will be available in OWLS once that goes live, hopefully in the fall sometime. Thank you.
Thank you.
Hi, great talk. Just a quick question. What's your plan for implementation of this now moving forward? It looked like, as you said, the surgeons and the nurses were the most engaged, but the techs, anesthesia, were not engaged. So are you planning to roll this out in a specific way and try to engage those other groups differently?
Thank you. The surgical techs were actually included with the nurses on that, so we did have good engagement with them, but definitely was limited with some of the other personnel in the OR. Our plan is to approach this how a lot of OR safety compliance modules are. Like, some hospitals have an annual fire program that they have to do. So our plan is to go through hospital administration and the OR managers, and this would then be implemented as a compliance module that you're required to have to be working at that hospital if you're in the operating room. So that's our plan for distribution. It definitely is limited in terms of the amount of information that it provides a surgeon, but we're hoping that some surgeons may do the compliance module and then be interested to then do the full FUSE curriculum, as that's probably more appropriate for a surgeon.
I saw that you mentioned that most OR nurses felt that it would result in a change in their behaviors in the OR. Have you assessed if those changes have actually occurred, or do you plan to assess?
That's a really good question. We have not had any plan to do follow-up, but it probably would be a good idea to do that, and certainly would be easy to go back to Beth Israel and follow up on that. Thank you.
I also thought it was interesting that the House staff participation was only 4% in your study, which makes sense if it's not required. What are your thoughts on whether FUSE should be required for general surgery residents versus just minimally invasive fellows?
Right. I do think it should be required content. It's very valuable, and even though there's more awareness of energy safety in the operating room than there used to be, I think it's still a long way from where it needs to be, and there's no place in the curriculum for most general surgery residents, not just general surgery, also OBGYN, all the subspecialties, urology. It really should be in everyone's curriculum, and it's not. So I think it should be required. I understand, of course there's barriers to that in terms of cost for programs, time. It does take about 4 hours to get through the online content, but I do think it's worth it.
Thank you.
Thanks.